Hi friends, it's Dr. Russ. We're continuing our series of shoulder treatment videos with this one. The patient came in with pain in the upper trapezius, the cervicothoracic junction, and we looked through it and we found that the problem was not where the symptom was, but elsewhere. And it's a pretty typical pattern, something that if you're a practitioner, you'll see a lot if you start looking for it. Hope you liked the video. Thanks for watching. Some ways you can support the channel: like, subscribe, comment, share the video freely, or become a channel member. Get early access to videos and badges and emojis, and we appreciate it. If you want to support, those are some things you can do. Thanks for watching. Let's get into it. So this is the symptomatic space here, yes?
Yep.
Okay. Tending to develop trigger point pain here, and also pain in this area, and just kind of getting a general sense, slight asymmetry. I would say, I wouldn't call this winging of the left scapula, but it is a little more prominent on the medial border, which I think correlates with some protraction on that side. And otherwise, symmetry is pretty good. Maybe there's a little prominence here, which might correlate with some C6 or C7 rotational tendency. Josh, can you raise your arms up over your head and really reach? Yeah, so the scapula moves really well on both sides. Good. Reach for the ceiling, really reach tall. Good, and then let your arms down.
I actually felt that just above my hip on the left side. If that's
when you reached up, you felt it down here.
I felt some, like, yeah, a little bit of something down in here.
Okay, so that's the latissimus dorsi, which we talk about all the time. It originates here from the iliac crest and inserts on the front of the humerus there. So as he's fully flexing his arm, he is stretching that lat and getting a little bit of strain on the iliac crest here. So we'll just kind of make a note of that for later. Can you turn around? And we're going to look at you from the front and get a sense of the contour here. Yeah, and you can see a little elevation of the clavicle on this side, the left side, that's the affected side. And we can see a little asymmetry, which I think is related to that clavicular elevation, where he's not quite as broad on the left as he is on the right. So that clavicular elevation might be SCM, which is a little prominent here, and it might be related to shortening of that upper trap and that trigger point that tends to develop there. But we might also be looking at some coracoacromial or coracoclavicular issue here. And I think I am keying in on a little prominence of his humeral head on the left side, which would correlate with a little protraction of that scapula and maybe some loss of anterior to posterior glide of the humeral head. And as I just give it like a little nudge and kind of test its mobility, it's kind of stuck there. So we're looking at, well, we want to address the symptom, which is in the upper trap. We just had a massage yesterday, right? We're looking at releasing the latissimus on this side. We're looking at open up this space and getting a little better clavicular position. And of course, we're always going to look at the lat serratus junction on the symptomatic side as well. So there's a lot to be getting on with. And let's start with you laying on your stomach.
Cool.
So we're going to start with the lower back. And I'm going to feel both sides of his iliac crest, lumbar spine, and thoracolumbar fascia. So I can kind of compare left to right. And here's on his right side, getting a sense of the mobility, and on the left side, definitely feeling some tension and restriction here. So where is here? That's his 12th rib right there. So this is all quadratus lumborum, lower latissimus, and lumbar erectors. And it's a little bit, well, it's a little resistant to movement. So making a note of that, let's follow that lat up and around. Bring some of that. Okay, so I'm feeling right here. Right here. So this is the very top border of the latissimus. So that muscle comes up like this way. And there it is. That's the body, kind of the belly of the lat. And sure enough, it's a little bit sticky right there. Okay, so making a note of that. Now here through the lower trap, the mid trap, the rhomboid. A little tight, nothing really particularly jumping out at me. A little trigger point right there. Had a lot of work done on his rotator cuff. This issue's been around for a year?
More than a year.
More than a year. So he's had a lot of different people looking at it, and there's been some different theories as to what's going on, including rotator cuff issues, and sometimes there's some pain around the glenohumeral, so there's been some suspicion of impingement, but we'll see. We'll see what we will see. Right now, in terms of his left side, this lumbosacral junction and iliac crest is kind of giving me the most information about restriction. So right there. So I think what we're going to do is turn you on your right side, so you'll be facing the window,
Yeah.
and we're going to work this line right here. Okay?
Yeah.
Go ahead. Okay, from this side lying position, we just have access to all the structures we need. We've got his arm in a position where it's out of the way for me, and it's in a spot that he can comfortably keep it for a while. So I'm going to start here. Even though it's a shoulder problem, this is where I think it starts. And we're going to work this iliac crest, pulling toward me and working all these attachments, internal oblique, external oblique, QL, and latissimus dorsi. All those things are just kind of layered together. And I'm using my thumbs now against the paraspinals, and we're getting a little traction. So my hand here on his iliac crest is giving him a little footward traction, while my thumb posteriorly is working its way through those layers where that thoracolumbar fascia meets the deep lumbar erectors. And we're just going to work our way up. Now reversing that traction to get some space in this direction. Nice. So Josh, I want you to breathe into my hand and lifting these ribs toward the ceiling. Good. And let it out. Good. So push into my hands as you breathe in. Good. And then just kind of let that relax as you breathe out. So getting some mobility through the left rib cage.
Can I continue that?
Yep. And keying into this serratus anterior latissimus adhesion right here. Yep,
Tender.
very tender. And if we can free this up, it's going to free up a lot of mobility for his shoulder, and that's what we want. Sometimes that upper trap develops the trigger point because it's pulling so hard against the tight, knotted up, restricted latissimus here on the rib cage. Yeah, deep breath and let it on out. So coming up this way, here's the latissimus, here's the serratus. The latissimus is here, the serratus is here against the ribs, and I'm just working my fingers along that latissimus border. That's starting to get a little movement. Good. Breathe into my hand again, Josh. Just lifting to the ceiling. Good. Making like big fan of those ribs, getting separation of those ribs. Good. Working my way up a little higher. Got some feedback from his massage therapist the other day about it's difficult to get on the subscap on this left side, and I can see why. And the temptation would be to kind of blame the subscap for being tight, but maybe it's really about this latissimus just not really having the mobility that it needs. Do you need a break?
Oh, all
Are
good.
you good? Deep breaths. I love it. Let it out. Good. Right there. Good. Trying to be gentle, but direct. You kind of got to get right in there. Good. Good. I'm going to move your arm now, okay? So doing this like mixing bowl with the arm so I can feel the movement of this serratus and lat on the side. And it feels good. You can see that's moving, right? That's sliding over the rib cage. That's what we want. So let's come up here, right into the posterior fold of the axilla. That's the meat of the lat, right there between my fingers. And I'm gripping it just until I feel that kernel of resistance right there. We okay?
Yeah, that's tender.
Yeah. So just keep breathing, nice and deep. Yeah, it's nice. Try to make your arm as heavy as you can. Good. So his arm is heavy in my hand. And you can see I'm just inducing a little movement. As I bring his elbow up toward the head, we're lengthening that lat just a little bit. And trying to get a little movement of those fibers. Good. Just let go. Nice deep breath again, Josh. And let it out. Good. Good. So here's that lat attachment on the humerus right here. So the way I like to work this is to reach with my inferior hand and just kind of sweep. Be aware of the neurovascular tissue against the humerus and come up this way and find this big old knot right here where the lat meets the triceps. And one more time. Good. So I'm pulling. I'm letting up the pressure a little as I roll over the nerves because I don't want to grind those nerves against the bone. And just being aware of his hair. We don't want to pull the hair in the armpit, but we do want to get way up in there. And it's good. Get some movement right there. Keep breathing. Good. Okay. Give yourself a minute there. So we're kind of just following that latissimus from the iliac crest. And here we are on his glenohumeral joint right here. And what I want to know is, does it spin? And does it glide? And is it stuck? So if we look at rotation, right, as I externally rotate and internally rotate his arm, I want to feel that bone spin under my fingers, which I do. I also want to feel really smooth movement of this pectoral tendon, which I don't. Right there. So I'm going cross fiber on his pec major here. I really would like that pec major to give me a little more mobility. Maybe we might have to come back to that. Here's his coracoid process right there. And his coracoclavicular space is really shut down right there. So coracoid here, clavicle here. He's 6'3" on someone of his height. I think there should be at least a finger or two worth of space in there. So how do we get space in there? Well, we just kind of gently open it. So I'm getting under the clavicle, giving it a little lift, getting on the coracoid, giving it a little pull, and always feeling for, like, where is that resistance coming from? What's holding it? I think what's holding the coracoid, something is pulling the coracoid up, which is weird because all the muscles that attach to it would pull it down. So I'm guessing something else on the scapula somewhere, yeah, is being pulled, or maybe it's being pulled by that clavicular elevation that we noticed when we just started looking at him. But I'm trying to open up this space. You okay, Josh?
Yeah.
Okay. If you need a break, just let me know.
Okay.
Okay. So let's raise the table a little bit for me. Okay, so I got his arm now in mine. I got my finger right on the coracoid. I'm going to traction it inferiorly and just wait just a moment. Let's see if something starts to change. Okay. Good. There's a little more motion. So as I traction it inferiorly, it does stretch a little bit, and I'm starting to feel this subclavius muscle come into play and some resistance here
There was some referring happened right there.
In a good way or a bad way?
No, I felt it like kind of like moving up across the front toward me.
Okay, that's the subclavius muscle. That's where we're at. And sit. Stretching it. Take a deep breath and let it out. Good. 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 Wow, that's way more movement.
Feels more movement.
Yeah, that's a lot more movement there. So I think we're on the right track. It's pretty deep stuff. Just kind of lifting his pectoral fascia, feeling an adhesion, however, right here. So getting some movement between the superficial and deep fascia. Here in the pec region, relax your elbow onto me. Thanks, Josh. And think now there's the coracoid, there's the clavicle, and I've got at least one finger worth of space in there. And I've got better movement of his glenohumeral joint. So let's move on from there for now. We could see, obviously, there was a lot of work here. His skin is really red. I like to remind myself that we don't have to fix everything in one visit. So I think we did a lot with his lat, his pec, his clavicle. So now I'm gonna key into what's going on with this upper trap. And we know it gets trigger point work, and that trigger point keeps coming back. So we can check in with it, but we don't want to overwork it. What I'm curious about is the vertebral movement and the segmental motion around C6, 7, and T1.
Sorry, should I be like leaving my head as if it's like a bowling ball in your hand?
Yeah, total bowling ball. Absolutely. And so I've got C7 on T1. I'm not going to do anything quick, okay? You won't be surprised by any sudden movements. But yeah, it's right here. So I've got on his left side C6 and 7, and it's tending to get stuck side bent left like that. As far as rotational movement, it's spinous left, so he's getting stuck in this position. So what we want to be able to do is bring spinous right and do a little bit of a lift on C6. So I'm going to lower the table a little bit, Josh, okay?
Yeah.
Gets you a little more in line with my center. Okay. So you can feel that I'm using my fingers to stretch that deep tissue right around that vertebra. So with my right hand, I'm under his occiput, and I'm providing some traction. You can see I've got him positioned in a little left rotation. So I'm inducing a very gentle right side bend and a lift on the left side with a little left rotation to bring that spinous a little bit to the right. And working the deep fascia, the posterior scalene and the levator to see if we can induce better mobility of that C6 on C7. Now, if I take my middle finger here, I'm going to scoop under and kind of hook onto that spinous of C6. Now with the heel of my left hand under his occiput, I've really got the ability to traction him on the left up this way. And if we were going to adjust it, it would be a pull up with my left hand and a push on the right side with my right hand this way. And it might make a little crack. Are you up for that?
Sure.
Is that a yeah? All right. Take a deep breath in. It's going to be a really small movement. And breathe out. Good. Good. Bingo. You still alive?
Yeah.
Okay, great. That was right where I wanted it, so I'm happy with that. Good. Nice. Everything else feels pretty good in there. Good. Okay. It was a lot of work, and we didn't waste any time. We went right for it. But I think we got some good work done. And I would say next time you came in, my recommendation would be within a week. I would go through that whole sequence again and just check in with all of those spaces and make sure that we're keeping it moving and see if we were able to key into any deeper patterns. And that's what I would do next.
Just so that I know kind of like what the stuff are where you think the challenges are. I think that's what you were talking about earlier. Like that's one of the things that I've found most difficult about this process is people keep giving me exercises to do, but actually like I haven't gotten a lot of clarity on what we think the reason that I'm experiencing this acute kind of like trap issue is.
Yes. So the trapezius is developing a trigger point.
Okay.
That's a irritable knot in the muscle.
Okay.
And that happens because it's overworking. And even though you're not overworking it, your normal day-to-day use feels like overwork to that muscle because it's pulling against some really stuck stuff. So the job of the upper trapezius is to kind of elevate your shoulder. Like that.
Which is what it's doing.
Which is,
it feels like it's doing that when I want to or not.
Right.
Okay.
And you've got some pretty strong muscles that are holding your shoulder in this depressed and forward position.
Okay.
And that's where the latissimus problem comes in.
Okay.
That's where all the stuckness around the coracoid process comes in, the pec minor and the coracoacromial arch. And that latissimus in particular extends all the way down to the hip.
Okay.
And so there's connection, we could probably find connection through the IT band and all the way down to the ankle if we really wanted to, and we probably should. But that's where I see the issue, is the sideline of your body, where the latissimus overlaps on the serratus anterior, on the rib cage, and deep in the armpit. And stuff here, which may be related to old injury or just postural habit, I don't know. That's all pulling that left shoulder kind of into this position.
Into the kind of forward. Okay.
Forward roll, a little like a depression. So now you're getting stuck in the ball and socket of your shoulder. You're getting stove up in here, and this is bearing the brunt. And that's the symptom that you're really keying into, and that's what is the most painful for you. And that's important that we work on that too. But I think, as far as I can tell, that first layer of causal issue is more on the sideline of the body.
And so in terms of, if I set up a time to come in next week to redo this, is there stuff from a personal standpoint for like exercises that I should be doing to try to like change how I'm holding or strengthen things that are deficient?
Yes. I think strengthening is premature, and I don't think weakness is really the issue. What I would focus on, and I can send you some videos, some exercises you can do with me, is rib mobility through the sideline of the body. And shoulder mobility in particular, that kind of like scapular retraction, but to do it not in a forceful way, but in a more gentle way. And I can send you some resources for doing that. I think probably 15 or 20 minutes a day would be really helpful. So that in the end, the postural change is not to pull your shoulders back, but it's actually to lift and broaden through the upper chest. So it's like a little bit of releasing through the sternum and the pectoralis region that allows your shoulders to slide back and down the rib cage and find a more relaxed and easy position.
And is there stuff that I should avoid doing, like if I'm swimming or if I'm lifting, are there things that I need to be not doing?
Yes. So I wouldn't do any overhead presses right now. I wouldn't do any shoulder shrugs right now. But I like those exercises, but for you right now, I would lay off of that. Did you say swimming?
Yeah.
What kind of strokes do you do?
Just free and breast. I don't do backstroke.
Okay. And so the freestyle, that's this, right? I would lay off that as well. Just for now. It's not a long-term prescription for the health of your upper body. It's just for now, so that we can rest these tissues and stop irritating them. But breaststroke, would be wonderful.
And then running is fine.
Yep.
And then in terms of getting to the gym, like lat pulls and all that stuff is okay, or seated rows is okay, but don't do shoulder press or shrugs.
That's a really good question. I'm a little iffy on lat pulls because we're working on the lat and we really want to free it up. And if we're going to put a lot of stress through it with resistance training, we kind of run the risk of hampering its ability to kind of adapt to the new normal that we want it to.
Okay.
So lat pulls are great. I love them too.
Yeah.
But maybe lay off those two.
Okay.
And focusing more on cardio, aerobic, and mobility.
Okay.
Okay?
Sure.
Yeah.
Cool.
Yeah. Good question. Anything else?
Sounds good.
Thanks. Great.
Awesome.
Okay. Great treatment. Thank you.